Hi everybody, this is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum. This session is about informed consent. It is part of the patient safety course and it is part of patient engagement. The objectives of this session to discuss the importance of informed consent, define elements of informed consent, explore communication barrier affecting informed consent process. Informed consent, this is a very important area of communication skills. It requires technical background plus the ability to communicate effectively. Informed consent is stemmed from the principle of respect of autonomy. So respect of autonomy refers to patient right to make decision and act according to their own values and belief system. This means that it is unethical for healthcare provider to interfere with the choice patient make unless the patient is in emergency situation or unconscious. Consent is almost needed in most medical intervention. It could be implicit or explicit. Like for example, when you ask a patient to want to measure his blood pressure, when he extends his arm, this is an implied consent. But for invasive and complex and complicated procedure, more detailed communication is needed, and also they are required to sign certain forms. The good thing about consent, it reflects the degree of patient engagement and understanding. Much of healthcare is delivered by relying upon verbal consent rather than a written one. But even verbal consent requires complete and accurate sharing of information with the patient. Written consent usually is left for invasive and complex, complicated hospital procedures. Some health professionals believe that consent requirements are fulfilled with the initial introduction of themselves or signing a form. Consent is more than signing a form. The consent process enables the patient to consider all the options they have in relation to their care and treatment, including alternative to the course of treatment. Like, what if I don't want to be treated or subjected to this procedure? It's important to be competent in completing the process of taking a consent. Unfortunately, time pressure and sometimes attitude of the provider can affect the process of effective information delivery to the patient. Informed consent has two elements. The first one, the element which inform the patient, including information provided by the healthcare practitioner and comprehension of that information by the patient. The second element that enable patient to make decision, which include time to absorb the information and comprehend them, and time to consult with family and other carers. Sometimes the patient might need to ask to get a second opinion, opportunity to make free and voluntary choice, and also to give patient time to ask about the competency of the healthcare provider during the intervention. It is not uncommon for patients to discuss consent with other healthcare providers, including a nurse, pharmacist, or physiotherapist, before or after they have spoken to their main healthcare provider or doctor. This second provider should communicate any concern patient have with the treating physician to ensure that communication is open and patient needs are met effectively. The person doing the procedure or treatment should ensure that the patient fully understands the nature of the treatment or the procedure and has been fully informed about associated risks and benefits. Patients should know the likelihood of success and the likelihood of harm should be communicated to the patient in a way that can be understood. When they are printed resources to aid decision making, this should be used. The patient should also know the diagnosis or the main problem. This includes test results and procedures. Without a diagnosis or assessment of what the problem is it is difficult for the patient to come to a decision about whether the treatment or solution will be beneficial. If treatment is experimental or exploratory, this should be disclosed. Also, the patient should know the degree of uncertainty in the diagnosis or the problem. Healthcare delivery is inherently prone to error. As more symptoms appear and more information is provided, the diagnosis may be confirmed or changed, or a problem reformulated. Disclosing uncertainty is essential. Patients should know risk involved in the treatment or solution. In order for patients to make decisions that suit them, they need to know about any side effects or complication associated with treatment or procedure, as well as any potential outcomes that might affect their physical and mental well-being. Also, they need to know the likely consequences of not having the treatment. Specific information about the known risk and benefit and uncertainty associated with specific treatment and procedure are important. And then to address any concern that the patient or caregiver have. Patients need to know the range of options, not just one favored by the practitioner. So they need to know what patients should know, the proposed treatment and expected benefit, when the treatment would start, the length of treatment and the cost involved, whether there is an alternative treatment that might be considered, the benefit of treatment and the risk of not having the treatment. The type of treatment or the decision to go ahead with the treatment or procedure may be influenced by other factors in the patient's life, such as employment, family responsibilities, financial concern, and the location of treatment. Information about the healthcare provider. The patient should know the name, position, qualification, experience of the healthcare provider doing the procedure. And also, if the provider is inexperienced, they need to know the degree of supervision provided by the institute. Financial impact and other support sometimes needed. Patient might require the service of additional healthcare provider. In some cases, patient might require non-medical assistance as they recover, like following outpatient anesthesia. They need a ride home. Sometimes they need someone to help them at home with daily activity following major surgery. Certain treatment may also require series of follow-up and appointment, and these need to be coordinated. Take home informed consent stems from the principle of respect of patient autonomy. Delivery of appropriate information and answering patient concern can enhance the process of taking informed consent. Patients should know about the details of the proposed treatment, expected benefit and risk of treatment, and the risk of not having the treatment, and if there is any or there are any alternatives. They should know when the treatment should start, the length of treatment, and the cost involved and financial burden. And also they need to know information about their healthcare provider.